confident smile can make all the difference in your job and your personal life. And now you can get that beautiful smile with no pain, no downtime, and it can be affordable. Here to tell us how, please welcome back cosmetic and family dentist, Dr. Terri Alani.
Hey.
So there's all kinds of ways to get perfect looking teeth, but some of those ways can be very expensive.
Exactly. You know, some people cannot afford the expense of veneers or maybe go through Invisalign. So now there's an alternative. I've talked about this on the show many times. But it's one of the most common things that I'm asked about. People always pull me aside someplace and go, okay, so that doctor, Snap-on Smile, really? No, it really is. This is the Snap-on Smile. It is a removable appliance, and it can actually change the shape, the color. It can fill in gaps. It's just incredible. Yeah, and the thing that, of course, people fear when they go to the dentist is the shots, the drilling, all that type of stuff. And some other methods, you do have to drill down the teeth and then put a veneer over it, whatever, but this is a different situation. And it literally, honestly, snaps into place. I mean, you hear it when you actually place it in the patient's mouth. And there are no injections, there are no adhesives, there's no glue. It's removable, and it's easy. Yeah, all right, so who would be a candidate for this, and what kind of work would you have to do before you actually get those made? Okay, let's discuss who is not a candidate. Okay. Someone that is not a candidate is someone that actually has active decay in their teeth. But they can become a candidate if they get that fixed? Exactly. They need to come in and have the decay cleaned up first. We don't want to put anything over something that's compromised. Right. They're not a candidate if they have any aggressive periodontal disease. You want to make sure also, or any type of mobility. If they have a lot of mobility in their teeth, then they're not a candidate. Because it needs to hold that snap on. Exactly. They're not a candidate also if they have flared teeth. If their teeth are flared because the appliance fits over your existing teeth, it adds a little bit of thickness. So if the teeth are flared, it just won't look right. Right. They also can't have any more than 6 teeth missing in one spot. Okay. But anybody who has those issues, you certainly can go to another method to fix them because you cover all kinds of cosmetic issues. Exactly. They're all kind of alternatives, but we want to have the best results. Okay. So when you come in the office and you're like, okay, I don't like this gap, or I don't like this, or even discolored, whatever it is that you have. So what's the process? You take an impression, or? It's very easy. First of all, we take x-rays to make sure all the teeth, everything is okay. There's no active decay. And then we take impressions. It's probably a 30-minute process. We write a lab script. We have the patient involved with us because each appliance is custom made. No two are alike. Yeah. And they help us pick the color, the shape, and we send it off to the lab. Yeah, and so I'm going to go back to color because so many times people go, I just want white. I want white, right? But there are various shades of white, and then sometimes that's not really looks good with you. White sometimes is not what you want. You want it to look natural. And then we send it off to the lab, and they usually get it back in around 4 weeks. Okay, we're taking a look at some before and afters here, and I mean, this person's teeth just look, it's perfect over here. And what I love about the after is that it's not this straight uniform row. It's what nice looking teeth would normally look like. Yeah, it looks really natural. It almost is a transition, or gives you to see what actually your teeth would look like if you had veneers or restorative work. Yeah. So it's sort of a preview. And these were for cosmetic reasons. This patient had upper and lowers done. You can see that we lengthened her teeth a little bit, and we also changed the color. She wanted whiter teeth. Yeah, and then sometimes people, it's like their teeth may be fine. And this one's incredible. Yeah. I hear someone, and that's a snap-on. Yeah, this is a snap-on, and if you take a look at how really unattractive the smile was and after, is pretty amazing, and it's only done in 2 visits. Yeah, and it's incredible because it really looks like real teeth enamel. So what is the material made of again? It's a specialized acrylic resin. It does not stain. It does not, you can drink coffee with it. Yes, you can even drink hot coffee. You can eat with it. And like any other appliance, of course, it takes a little bit of time to maybe get used to speaking, but then it's fine. And you can do just either the lower, you can do upper and lower, or just the upper. Yeah, can you do partials? Yes, you can do partials. I think we have some pictures for partials. Oh, wow. So, yeah, this is, not only did we fill in the gaps. I think you got an amen on that one. These are amazing pictures, and these are all my patients. You can also do upper and lower again. Wow. Because otherwise, Terri, the option for people like this might be a dental implant. Again, that's a whole other level of expense. Dental implants. It works, but a whole other level. Yes, or partials where you have the unsightly clasp. You can also, this patient actually is waiting for an implant in that gap, And so they use the Snap-on Smile until the implant, they actually get their implant.
Okay, that brings up another point. Somebody may use this temporarily, but could this be the answer for somebody for the duration?
Absolutely. Okay. Yes, they last around 3 to 5 years, and then you could probably just, you know, get another one because they're very, very affordable.
Yeah. You just heard the reaction from people in the audience, and you look at it and go, wow. And again, it's done in a snap. Literally, that person wakes up with the smile that you saw that on the right side or the left side, whichever, but the before, and then they literally in a few seconds snap in a whole new look.
And you also can raise the bite. You have some patients that might have lost like the surfaces on their teeth, and so their bite is over closed, and you can actually use it to raise their bite.
Yeah.
This patient had lost a lot of surface wear, so we used it. If you notice, we opened their bite up a little bit.
Yeah.
So there are a lot of applications for Snap-on Smile. It can be used for hundreds of our patients. We've been doing it for the last 4 years. I actually teach dentists and I lecture and teach other dentists how to use this appliance correctly.
Yeah, and then how many visits are we talking generally before you get this?
It's 2. It's the first visit, and you usually wait 3 to 4 weeks, only because it's computerized, and I actually preview everything before I will deliver it to the patient.
You want it to be perfect for them.
We want it to be perfect for them, yes.
Yeah. Okay, this is amazing.
It is.
Dr. Alani has a special offer for Great Day viewers, $100 off a Snap-on Smile. Call her office at 713-621-5141, 713-621-5141, or find her online at Texastoothlady.com. And I just want to say, the reaction that we had from the audience were like, whoa, that's a reaction you get in the office so many times, because what you're also giving people is not just, you know, perfect looking teeth for perfect looking teeth. It really does impact someone's self-esteem.
We give them their life back, basically. I mean, we have a lot of patients that actually they see the mirror and they just start crying. Yeah. I mean, it's very rewarding for us.
You know what? I've run into a few of your clients who have said, I actually could go for a job interview now.
Yeah,
that was the thing that was holding them back from actually applying for a job.
It's an affordable alternative that we never were able to offer our patients until now.
All right. You can also catch Dr. Alani and her brother, Dr. Wayne Alani, on the radio every Saturday morning on Talk 650. Thank you very much. Speaking